Member of Cypress-Medicine had.
Mr. Speaker, just last week, Alberta Health Services released its performance report for the first quarter of the year in October. It's clear why AHS is dragging its feet. Of the 17 performance measures given, AHS has achieved its target in just 4. 4, Mr. Speaker. AHS has missed on ER wait times, patient satisfaction, and access to cancer treatment. To the Health Minister, how much longer are we going to tolerate waste, inefficiency, and poor performance from this organization?
The Honourable Health Minister.
Thank you very much, Mr. Speaker, and thank you to the member for the question. What the member doesn't point out is the fact that AHS saw growth in every single one of those categories, and I think that that is something to be commended. Right? The other thing I want to point out is the fact that the member opposite's party is proposing to cut significant money from frontline services, which obviously would not help.
Point of order. Point of order is noted for supplemental.
AHS underperformance is nothing new, Mr. Speaker. In fact, members of our current government in the past had plenty of perfectly valid criticisms about its inefficiency, lack of accountability, and chronic poor performance. When AHS does not meet its targets, it's allowed to lower its standards. We went from 52 performance standards to just 17. Again, to the Health Minister, we all know about the mistakes of the past, but will this government right now commit to restoring complete, transparent, and extensive quarterly reports for Albertans?
Thank you, Mr. Speaker. The report is public. It's on the website. That's how the member heard about it. What I want to point out as well is that the 17 pillars that are there and that we're being benchmarked against, the point is to make progress. And I think that members opposite might want to create some chaos by cutting budgets and by pretending that they can blame certain individuals within the system. What we need to do is provide stability, and that's what Albertans voted for, and that's what I'm proud to deliver.
Mr. Speaker, among the many targets gutted from previous Alberta Health Services public reports are surgical wait times, including hips, knees, and cataracts, the number of seniors waiting for continuing care, staff morale, and department costs. Given how badly AHS was failing, it's no wonder they'd rather not talk about it. Does the minister agree that these standards are crucial for the accountability, transparency, and oversight of our healthcare system, and Albertans deserve to know?
Good question.
Thank you, Mr. Speaker, and thank you to the member for the question. I will take his recommendation that we expand the number of key pillars moving forward into consideration. What this government's committed to is making sure we fulfill the commitments that we made in the election. I know that might be a surprise to some members opposite who think that we actually shouldn't be fulfilling our promises in the campaign, but this government's committed to doing that.